Hello, you're welcome to day 3 of our post awareness campaign, and today I'll be treating something that affects a lot of women: osteoporosis and how it can be prevented. Osteoporosis is just our bones getting porous, and it starts from the inside. There are two parts of the bone: the outside part that is hard and solid, and the inside part that is kind of spongy. Osteoporosis begins from the inside, the spongy part of the bone. It's just the spongy part of the bone getting porous that gave it the name osteoporosis. Okay, and when this inside of the bone start getting porous, it also weakens the other part of the bone, that's the outside part of the bone. And you don't get to know you have osteoporosis until you have a fracture, until you fracture your bone. That's the only time you get to know you have osteoporosis. If you don't go to test your bone density in the lab to ascertain how dense your bone is, the only time you get to know you have osteoporosis is when you fractured your bone. There are two different types of bone cells: the ones that build up the bone and the one that destroys damaged or old bone cells. Now, as you get older, the bone building cells decreases while the bone destroying cells increases. That is why you start losing your bone density rapidly from the age 35. Your bone density start going down because of that imbalance in bone building and bone destroying cells. This biological process that occurs as a result of aging and the hormonal shift that occurs during menopause weakens the rate at which women lose their bone density. Some women remove their womb or ovary to prevent pregnancy. This actually worsens or increases your risk for osteoporosis because you get to enter menopause in time, and once you enter menopause, there is a drop in estrogen level, and the drop in estrogen level affects your bone density directly. Aside menopause, there are other factors that can increase your risk for osteoporosis. Number one is family history of osteoporosis. If your mom or sister suffered from osteoporosis, it is most likely that you're going to suffer from it if you don't take caution. Number two is increased body mass index. If you're a very fat person, it can be a predisposing factor to osteoporosis. Another one is chronic use of steroids. If you've used steroid for long, it can predispose you to osteoporosis. So if you are on steroid, do well to ask your doctor if there is an alternative to that. Then number four is heavy drinking. If you drink alcohol a lot, it can predispose you to that. If you smoke a lot, it can equally predispose you to that. Then another thing is rheumatoid arthritis. It's also a predisposing factor. Malabsorption syndrome is also a factor in increasing your risk at getting osteoporosis, because when you're having malabsorption syndrome, it could impair the rate at which you absorb key nutrients that you need to build stronger bone, like calcium, protein, and magnesium. Another thing that can increase your risk for this osteoporosis is anti-cancer medicine that lowers estrogen level can increase your risk of osteoporosis. Now, I'm not a prophet of doom. I'm not going to leave you without solution. So let's dive right into how you can prevent osteoporosis. But before we do that, I need to emphasize something. A lot of women misconceive that the waist pain they're experiencing is as a result of childbirth. It is not childbirth, it's just as a result of your bones getting weaker. And the most common fracture that women usually have are hip fracture and wrist fracture on the weight bearing point. Spine fracture is also quite common. Now, to how you can prevent osteoporosis, there are 3 ways to it. Number one is hormone replacement therapy. That's getting a boost of estrogen and testosterone. But before you go for hormone replacement, you must consult your doctor. And hormone replacement you can start taking hormone replacement therapy 5 years after menopause. But before you do, you should consult your doctor, because there are ways to it. There are strategies to giving women hormone replacement therapy. Two is exercise. Exercise increases turnover of your bone building cells. Exercise increases the turnover of your bone building cells. So the more you exercise, the more you strengthen your bone, because as you're exercising, you're increasing the bone building cells that will help you to build a stronger bone. So exercise, and it's not just any kind of exercise that you go for. You go for exercises that impacts your weight bearing angles and that helps you to build muscle. The exercise you should be going for are: number one, resistance exercise and weight bearing exercise. Weight bearing exercise includes skipping, running, walking, brisk walking, tennis playing, swimming, cycling. And resistance exercise are push-ups, weightlifting, that helps you to build stronger muscles, because the more muscles you have, the firmer your bones. The more muscles you have, the firmer the structure of your bone and your muscles. But if your fat mass is more than your muscle mass, it weakens the bone. But when your muscle mass is more than your fat mass, it strengthens the bone. It gives the bone solid support. Then the last is dietary supplements. There are 3 key nutrients you need to build a stronger bone. 4 actually. You need 4 key nutrients to build a stronger bone. Number 1 on the list is calcium. Number 2 is protein. Number 3 is magnesium, and the 4th one is vitamin D. Now, protein is a building food that helps you to build new bone cells. Then calcium and magnesium are very key in strengthening the bone. They are components of the bone. They are key components of the bone. So you need calcium, lots of calcium for stronger bone. But if you are supplementing, if you are taking calcium supplement, you should take it with caution, because if you take very high dose of calcium, your body does not absorb calcium that way. It does not absorb calcium when it's in high dose. So if you take very high dose of calcium, it could precipitate and form kidney stones, because the organ that filters calcium and excretes it is the kidney. So if you take high dose of calcium, it could result to kidney stone, and you end up complicating issues for yourself. So if you're taking calcium, you take calcium in low doses with vitamin D. Vitamin D helps the absorption of calcium. But in a situation whereby you step outside a lot and get enough sun exposure, you don't need vitamin D supplement, because UV rays will help you to activate the vitamin D in you already. Vitamin D is already in you, but it's inactive. But once you step out and get hit by the sun, it activates vitamin D, and that vitamin D will help you to absorb calcium. Another one is magnesium and collagen supplement is equally key in helping you build a stronger bone. Hope you got value from this. Please like, subscribe, and share with your friends. Catch you tomorrow.